today at the Miracles at the Royal Children's Hospital. So we're going to talk to someone now who helps create these miracles. She is the Director of General Medicine at the RCH, Dr. Sarah McNabb. Welcome, Dr. McNabb. Can you tell us a little bit about what your job entails every day?
Oh, well, thank you for having us and thank you so much for your support. My job, I'm the Director of General Medicine, so I'm a paediatrician, so I help care for the children who are in hospital, but I also lead a team of others who are helping to do that as well.
It's been a tough year all round. What impact did COVID have on the hospital?
Oh, COVID had a huge impact on us from a process perspective. Thankfully, what we discovered as time went on was that COVID itself didn't affect children to the extent that it affects adults. But the processes that we had to change, we had to restrict our visitors, which was really very difficult. At times, there were only one parent at a bedside. We set up, overnight, essentially, we set up a respiratory infection clinic so that we could swab children and their families to try and identify which had COVID, and we've swabbed over 40,000 children and their families over the past year.
It's a remarkable number, isn't it, when you think about it at that time. We're going to talk now about RSV. What is it and what are we doing at the Children's about it?
So that is a virus that affects children. So RSV is a very common respiratory virus. It usually affects almost all children before the age of 2. For some, that'll be just a very simple cold, but for many, that's a very significant illness. Last year, we found that with the COVID restrictions and all of the public health measures that we took, we had very few children with RSV. We basically, our restrictions didn't just get rid of COVID, it got rid of most viruses.
I was going to say, that was the upside, if there was one upside to this whole pandemic. I've got 2 young kids at home and it was nice to not have those usual colds and flus in the house.
That's exactly right. The problem is that it's come back with a vengeance.
Yeah.
Yes. So all of those children who weren't affected last year are now getting affected, and we've actually, the last 2 months have been our busiest months on record. So our emergency department every single day is seeing about 10 or 20% more patients than their previous busiest days pre-COVID. So it's really had a massive impact on our hospital.
How do you treat those kids, and what do you say to parents who are thinking about perhaps bringing their children in who've just got a cold?
Yeah, look, it's difficult. We usually say see your GP in the first instance, of course. It has been really difficult on our GP colleagues as well, though, because they similarly have to put COVID precautions into place. RSV, unfortunately, there's no actual treatment for it, so we support children who need it with oxygen and we help them with their fluids if they need it.
Now, we're so proud of the Royal Children's Hospital being one of the leading children's hospitals in the world, but how much importance of keeping the hospital at the forefront of research and technology is it, and what does the appeal do for your area of expertise?
I think that's exactly it, that the appeal helps take us from being a really excellent hospital to striving to be a world-leading hospital. For me personally, the appeal has had an impact on our research, so it's helped fund some of our brightest researchers. It has also helped, one of the things I particularly love is our simulation centre, so that's a whole big setup where we can go in and practice procedures and practice interventions on models rather than on children themselves.
You hope that your kids don't need to go to the hospital, but it's a great reassurance for all parents to have the Royal Children's Hospital there just in case, isn't it?
I think so. My own children have had to be there, so So I think it's I love working there. It's a real privilege.
All right, Dr. Sarah McNabb, really appreciate your time.
Thank you
Keep up
so
the
much.
good work.
Thank you.
And we'll have more coming up.